Chad, thank you so much for joining us at the Therapist Hour, our anchor interview.
Thanks for having me. I'm excited to be here.
Yeah, and I'm really excited to have you here with me because you're someone who shares a lot in common with me in terms of being a therapist, but also being familiar with military culture. And so, for me to have you here means that I get to learn from someone who, comes from my background and
Right.
is doing the same work that I'm doing in the world. And that feels really special to me. And can you just, introduce yourself to the audience? You're working as a social worker in Colorado. Do I have that right?
Counselor.
Counselor, yes,
Yeah.
just like me, you
Yeah.
see?
Yeah.
We're both counselors. And you're located in Colorado. You see patients, but you also teach at a university. And can you just tell the audience a little bit more about yourself?
Sure. So yes, I primarily have a private practice in Denver, Colorado, South Denver. Um, I've been doing that on and off 20-ish years. Um, Also have worked inpatient and intensive outpatient programs, so kind of a good mix of clientele in different situations. I also teach part-time at Metropolitan State University of Denver in the psych department, mostly clinical psych classes. Um, Not a ton. I kind of do, one or two a semester just to kind of keep my feet in that world. Um, I just enjoy teaching, and so it's fun to interact, and it's a nice break and change of pace. From the military, I'm a Marine Corps veteran. I joined the Marine Corps right after high school back in the 80s, long time ago.
Yeah.
Um, so was in the military. I was an armor and was a vehicle commander on an armored personnel carrier and was in Desert Storm, Desert Shield, kind of the first dip into the whole Middle Eastern conflict world that hopefully is starting to peel back a little bit at this point, but has been, present in our lives this whole time. So I haven't stayed really intentionally connected with the veteran world. Like, certainly have some friends and just colleagues and some other things like that. But working with veterans has really just kind of been through coincidence and networks, friends of friends, and those kinds of things. Because I think outside of the formal VA system, it's really hard for, as I'm sure it's hard for veterans to find therapists that they feel comfortable with and feel like have some understanding of the world that they live in and some of the experiences that they've gone through. So, I'm sure we can talk about that later, but that's a one piece of being a male therapist, which I'm in the minority just there. But then also being a veteran, I have a black belt in Brazilian Jiu Jitsu, and so that's another kind of place where I get overlap with men and veterans, and violence and aggression being a clinical and academic interest as well as something that's been played a role in my life. So that's kind of all worked together to carve out this little niche or my own little strange world of therapy that I live in.
Well, and it's interesting that you bring up culture because I did not work with veterans until 2 years ago. And when I sat across from my first veteran, I had a full circle experience because I grew up in the military. I was an Army brat. And really, when I left the military, which means my father retired from the military when I was 16 years old, I never looked back, and I didn't even reflect on how the military culture had shaped me as a human being until I found myself sitting across from veterans and having the experience of just understanding their culture without even trying. It was almost like I was breathing again,
Mm-hmm.
and I was back home. And so it's been a real positive experience for me to work with veterans and to feel comfortable doing it. It's almost like having a small hometown practice where you've grown up in that town and you're working as a therapist in that town, and you just understand like how the town kind of breathes.
Right, right.
Yeah. So that was one reason why I was personally so interested with inviting you to join us today, because I really want to learn more about your understanding of like violence and if you can just like let the audience know like exactly what is your expertise academically, what are you studying and teaching?
Well, currently, kind of my cornerstone class, I teach and I just teach at the undergrad level, so I'm not working with graduate students. So I'm not associated specifically with any active research or anything like that. But kind of my cornerstone class is a psychology of violence and aggression, which is interesting because I just kind of stumbled upon that. It was a class that was in the university catalog that kind of jumped out when I first started teaching. But then as I got into it and started to really create my own class, it became really striking to me that the kind of academic world of psychology has a very, the right word, limited or narrow scope of how they conceptualize and then study and teach violence and aggression. In most of there's only a handful of textbooks even out there, but in trying to just read as much as I could and kind of get acclimatized. And then I reached out to some people that I saw had been doing some research. Really, psychology kind of takes the stance that violence is inherently pathological, similarly with aggression, and really looks at it as most of the definitions would be something along the lines of um, a behavior intended to harm or destroy, focused on someone who wanted to get away from it, really. So that kind of criminal victimizing dynamic, which is true, but it's certainly not comprehensive. Um, and almost came from more like an activist perspective. So that I think also alienates people, especially men, that violence and aggression is not pathological per se, and is actually something that comes from part of their identity and part of their, in the military sense, right, part of their culture.
Right.
And so, that really further from the get-go puts a barrier between people coming from that world and that have integrated violence and aggression as part of their identity and their culture and something to value. And then a world of therapy and a world of psychology that says, that's inherently pathological. And the only thing that you're trying to do is hurt people that don't want to be hurt. And so not surprisingly, that's a real hurdle to really connect with people, first of all, but then also to really engage in treatment, because I don't at all necessarily see it that way. And so, back to the academic world, then it allowed me kind of the opportunity to carve out and present to students, maybe it's not that narrowly focused, right? Not to deny that that specific type of violence and aggression does exist, and is a significant issue in a lot of people's lives, but there's a whole nother realm of things going on and other dynamics that really don't fit into that narrow window at all. And so from the academic world, that's really, it's really enjoyable for me to kind of lead students down a path and let them self-discover and kind of break those biases that, the culture, our general culture, but then also the world of psychology is kind of teaching them as well.
Yeah, and I mean, this is a really complex issue, and I'm very much discovering that when I am doing psychotherapy with veterans, because one thing that comes up is the majority of veterans that I'm working with, they actually come from families where there was early childhood trauma, right? And so that plays a role in their experiences with violence and aggression, and then also what they experienced through their military training and when they were actually on deployments. But then we also have to hold, the refugees from war. And I know on this at therapist hour, we have therapists that are with us that are working with those refugees. So they're going to be very interested in understanding your, perspective with violence and aggression in order to be able to work more deeply with their patients. And something that's interesting about the group of therapists that are joining us today is they work with a psychodynamic model that actually accepts anger and rage as a natural part of the human expression. So I want you to feel as comfortable as you can to speak as openly as possible, because we are people who respect those emotions and do understand that we have so much to learn.
With almost any psychological dynamic, there are nature and nurture elements that are interplaying, right? Um, so, certainly the psychodynamic perspective, even going back to the roots, um, you know, uh, inherent drives, right? And with aggression being one of those, is kind of a foundational Freudian idea,
Mhm.
and that those energies and those drives are naturally and inherent and born into us, right? Um, then you can also go, the biological perspective, saying, testosterone, areas of the brain, things like that, that are kind of natural generators of aggression. Um, and then even in the evolutionary psych model, that plays a huge role as an adapted element of our psychology, is that's how we have evolved and learned to be that way. Um, and then you kind of have on the other side of the coin, you have more of the the nature, the learned perspective coming from behaviorists. The cognitive model really kind of says everything is a byproduct of our thought process and those kinds of things. And so violence and aggression, or even the emotions of anger and rage, would be byproducts of thought processes which are conditioned and learned. um, and then to whatever degree you kind of add in a social justice model, certainly that's going to be looking at the victims of violence. And so therefore we're again setting up that dynamic where people that perpetrate violence are to a degree dysfunctional and criminal, right? But
Mhm.
that is oftentimes thought of as it's a learned thing, right? They were abused, or they were raised in societies or cultures that valued that. um, but I think that you can understand, especially working with a veteran population, especially special operators, right? There are people that I don't understand how anyone could actually get to know them and say that these people are not just wired differently.
Right.
That it's not, and that's not to say anything bad or pathological. Um, these are just people that, whatever circuits you want to indicate in them for violence and aggression, are heightened and really strong. Now, there's been all sorts of nurture and learning and conditioning and all that stuff that have added to that. But to say that, this is all just some type of a conditioned response, to me just seems to be a completely, it seems kind of absurd, actually, and really a denial of just common sense evidence.
Right, right. Can you give us an example of what that type of person looks like? If they were to come into our office, like just so that we can have a picture.
Well, usually it's going to be male. Um,
Mhm.
so for violence and aggression, um, male aggression is much more typically physical, whereas female aggression is much more reputational, right? So it's dealt with. So the occurrence of like population-wide aggression is pretty similar. But when you get to physical violence, and then it's certainly extremes of physical violence, you get kind of a Pareto distribution, 80-20, and it becomes almost exclusively male. And so for people that would be extremely violent or especially violent, those are almost all going to be male. And so for somebody like that, there's a few that would fall into kind of standard DSM diagnoses, antisocial personality disorder, things like that. But that's a really tiny population. There's a lot more people, and it manifests usually in the military, in sports. There's another place where you'll find really hyper aggressive, masculine. And those people they tend to just have more of a hairpin trigger, and internally for them, the barriers to go from 0 to 100 are much smaller than for an average human being, both in the drive to have those types of emotions and behaviors, but then also in their mind, the kind of cognitive structures that rationalize and justify that would be acceptable, right? And so that type of a person, again, is probably going to be male, is probably going to have some type of history of lifestyle that they found some way to kind of to live out that part of their personality. So it could be military, it could be sports. In some settings, it could just be living a really difficult, like in a street life, right? Gangs, some type of criminal behaviors. So finding out something like that, sometimes men have channeled it, or people have channeled it into more kind of blue collar, really physical work. So it's kind of a sublimating process there, where they've gone and they kind of physically exhaust themselves and physically express that and channel it into some type of a work situation. So it's usually going to be somebody in that, which is, again, we're starting to paint a picture of a very atypical therapy client.
Right.
Those aren't the people that typically come walking in and say, hey, I want to do talk therapy.
No. I mean, and I have found a lot of people will come in wanting to do talk therapy because they know people like that. And this is so fascinating. And those people have influenced them. And I'm talking about the veteran population right here, on deployments through their training. That's something that is fairly common, or, from their family of origin. And so, that would be the more typical client for me. Definitely.
Right. Yeah, a lot of them come with, they're either mandated, right? Some type of a program where they've had some type of issues, and then they've been kind of mandated or strongly encouraged to go to therapy. Or it is, again, they're just having difficulties coping. And so there are some kind of lifestyle problems that are happening. And so the people close to them have been like, hey, maybe you want to go in and look at this. But I think, and we've talked a little bit in different situations about that population, especially the military population, tends to look at therapy almost more like training rather than this emotive, connecting, nurturing, healing model that a more kind of stereotypical client, civilian client would come in for. And so that would be one shift right away, that as a therapist, it's going to be much more focused, and they're going to relate much more if it's kind of in that kind of schema of it's training, what we're doing.
Like psychoeducation.
Right. And then even the particular skills or the types of things, the homework or whatever we're doing, if we can kind of formulate it in the thing of, it's almost like a workout,
Mm-hmm.
right?
Mm-hmm.
And so that's something that is inherently valuable to them. And they
Mm-hmm.
also very much understand that. And so that's something they can grab onto and they like that. And that, you can really build a lot more buy-in my experience, with that, rather than being like, oh, hey, let's sit down and from person to person, let's just make that type of connection, that kind of Rogerian, client-centered, unconditional positive regard style. Um,
Mm-hmm.
that's okay, but in their world, especially in the military world, in the sports world, that's not how people are,
Mm-hmm.
right?
Mm-hmm.
Your
Mm-hmm.
coach doesn't typically want to come over and talk to you about your life and your spouse or your girlfriend and give you a hug and say, let's have a good cry. No, they yell at you and they tell you what to do and they tell you what you're doing wrong and they give you this very kind of rational, formulaic way to improve.
Right.
And
Right.
that makes sense to them.
Well, all of us are emotion focused therapists that have joined you today. So, we're going to be sitting across from these patients and wondering, how can we help this person become more connected to their emotions, connected to
Mhm.
themselves, connected to others? And I know for myself, this is where I get stuck. There's two areas. Number one is, how do I work with the emotion of anger and rage? Because
Mhm.
from a therapeutic perspective, how do I do that? I mean, with people who repress their feelings of rage, I know how to do that. I've been trained to do that, exposure and desensitization. But what about somebody who has been on the battlefield and has had a lot of experience expressing their rage? Then how do I help them express their rage in terms of like the relationships that they're in, or the childhood that they experienced?
Right.
And then the other thing that comes up for me is the role of self-attack. And what I've learned is self-attack typically originates from childhood, but it's so kind of reinforced during military training, and then also through veterans' experiences in the military. And what I hear in my office is, I can do better. I screwed up. I'm and I'm being nice right now because I don't really want to say out loud what I hear, because it's the self-attack so horrible to listen to. It
Right.
hurts
Right.
when people open up and share.
Right.
Um, so is there any way that you can help us understand, like, how do we treat someone who has a predisposition for violence,
Mhm.
and who has a lot of experience with it, and who is going to be more comfortable with training and I guess interventions that are CBT like? But what if you're an emotion focused therapist, and that if you can help your patient connect with their emotions, that change
Mhm.
will happen, and it will be beautiful.
It's more of, the emotions are going to come secondary, right? So the connections, and especially, even like the therapeutic alliance and those kinds of things, are typically going to come more from a rational place because that's safe, right? Um, Even, and I'm sure you've experienced this working with veterans, and especially if getting them talking about combat experiences, things like that. Um, they instinctively talk about those experiences first, um, in very dispersonal, technical ways, right?
Yeah.
So, I was doing this exercise with this particular gear and saw this and engaged this target at this way, and there's lots of jargon and there's lots of technical things, right? Because for them, again, it's the emotional component of it is uncomfortable, and it's also secondary to the rational. The rational is how you make it through. If you allow yourself to get taken over by your emotions in that situation, you're going to die, and your friends are going to die, and you're going to stop being able to function because combat is beyond our brain's ability, it's overstimulating and we can't really deal with everything that's going on. So we have to kind of cognitively dissociate and really narrow things down to focus on, and that's what you're trained to do, right? Focus on your what's right in front of you, focus on your job, focus on the gear, right? Just kind of become robotic about it. And so, not surprisingly, that's their coping mechanism. Now, you're gonna have to then make the connection with that client in that same world. And then the emotional components start to trickle out slowly later, right? If you kind of go right for the emotion, it circumvents kind of their entire worldview and their entire coping system, right? Which I suppose, depending on the situation, maybe that's, therapeutically what you need to do in a session or want to do. But to feel safe and to really establish that therapeutic alliance, they're going to kind of need to connect with you in that safer, cognitive, rational way, right? And then you can slowly kind of add in a little bit of the emotional components as it feels more safe and as they have constructed a way to understand it, right? They feel, kind of going back to our training idea, they've trained enough in therapy, right, that they wrap their brains around it. They've got some models they can use, some formulas they can plug things into. And now we can start to kind of add in that emotional energy into that cognitive framework, right? And then they can start to realize, like, oh, this actually works and it feels better and I'm getting benefits out of that.
Yeah, and one thing that I have noticed is how important it is for the veterans that I work with to have a team of support that supports psychotherapy, because they present so stoic, and oftentimes I am unaware, because the language doesn't exist yet, of what actually is happening inside, like how they are being triggered by the work. And when they have like a coach who happens to have experience in the military too, that can be really handy, because a coach can be available 24/7 and can offer support from the place of understanding. They've been in the same places, they've been through the same things, but also family members and friends. And so the first thing that I do is really try to help build a team for the veterans that I'm working with, so that if they do get triggered in a way that they're not able to articulate to me in the moment, there's someone else with me that they might feel more comfortable talking to and processing things outside of the session, and then finding the courage to talk about emotions with me again. And because I think talking about emotions, what you're experiencing, what it feels like, is just so counterintuitive that there's, like you said, there's training. There's a training process that requires a lot of support from more than just the psychotherapist, right? I mean, it's like a lot of the people that I work with have to put down like a daily behavioral plan where they're meditating and journaling and practicing talking about emotions, and that daily plan is up and running and supporting what we're trying to do in psychotherapy.
Right.
So
and I think you're really battling a lot of times too, a culture war and a problem with identity that is a really big hurdle, right? Because the world of therapy is really the polar opposite from the world of violence and aggression, right? And so therefore, someone who a significant part of their personal identity comes from a world, a tribe of that values violence and aggression and stoicism and being hyper capable and all of that kind of stuff, right? then and anger and rage are, along with, it's kind of cliche, but men, especially men in the world that we're talking about, anger and rage and extreme joy are the only two emotions you're allowed to have.
Hmm.
So, and those are celebrated, and so you kind of get carte blanche to do as much of that as you want. Um, but then you come into the therapy room and we're supposed to cry and talk about being afraid and doing it, and it's like, wait, what? No, 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 no. And they can intuit really that oftentimes the therapist is very uncomfortable with anger and rage, is uncomfortable with aggression, is uncomfortable with, in their mind, the type of person that they have pride in, right? And so there almost becomes this kind of almost like a shaming barrier that's there, because oftentimes, especially at the beginning, um, these people will feel, kind of intuit that, like, look, I'm not welcome here, and you don't really like me, and I'm the scary guy that you hope you never meet. And now I'm supposed to open up to you and talk about, and we're supposed to cry together. So like, no, 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 no. Like, right? That's not who I am, and that's not the kind of people I value. And so bridging that world is such a huge gap, especially in this population, because it's really this, identity and culture war.
I mean, I want to share this one comment, and then I want to open up to the audience, because I know people have questions and they want to learn from you. But one thing that I have realized after my 2 years of working with veterans is my military experience as a child is the bridge. I'm a psychotherapist working with veterans, and just by luck, I happen to be raised by veterans, and that's the secret sauce. That is what is helping me figure out how can I help the people who sit across from me cultivate self-compassion, self-love, self-care, self-protection. And the reason why I'm so focused in on that, and I just want to shout out to Sunita Merriman, who we interviewed with a few weeks ago, and she really talks about the importance of these concepts, is that if I can help the person sitting across from me experience, self-love, then I know that it's just going to cascade into their families and work relationships.
Yes, yes.
And that's my goal, every day. And
it's really, I think, exactly speaking to what you're talking to, it's really trying to avoid or just prove this dynamic of either or. You either have to live in your world, or you have to give that up and come to touchy-feely world and do that. And that's because they're not going to do that. They value their world, and they kind of look down on the other world. So it's much more of a both and it's much more of a, how do you now learn, train to become more? So you're not necessarily letting go of the old ways and the old identities, you're just adding to them. And so it's just becoming a much more comprehensive person, rather than saying you have to stop being that one and become something completely different, because they're not going to do that.
Right.
Because they don't value this new one, especially at the beginning, anywhere near as much.
Well, and I think that, another reason for the perfect fit that I experienced is that I've been trained as an experiential dynamic therapist. And so Lee McCullough with affect phobia therapy, Rob Naborsky with ISTDP, Alan Abbas, John Fredrickson, Davin Liu, Patricia Coughlin, the list goes on with all these master clinicians who have trained myself and the people that are on this call in terms of how to work with real emotions. And so, these are therapists that are comfortable with the emotions of rage and anger, at least a little bit. They have a lot more to learn, but they're open, and they're also very well educated on understanding how rage is so closely linked to love and sadness and grief and closeness. That it all comes together, and a human being needs to be able to experience all their emotions to be operating in a healthy state. So I just want to thank you, Chad. I have to let other people talk. So
sure. There was one thing that popped up real quick I wanted to add in. In the dynamic of these clients and the therapist, one thing that we have to also kind of keep in mind, I think, is that men in general, but even more so people from this world, are extremely sensitive to dominance hierarchies, right? In their world, everything, there's an established pecking order all the time. Military formalizes that with rank and the honor and that's given to particular, especially the most violent, the most aggressive of those. In sports, there's who the best is, and who the person that gets picked last on the kickball team is, right? And that's something that's really important and kind of leads a lens that they look through the world. And so when they walk in the room and meet with the therapist, there's going to be this power struggle and this establishing of the pecking order, right? And it's not that the therapist needs to become dominant. It's just more that they have to earn the respect in order to be paid attention to, right? So if you're just going to be the puppy that rolls, if the therapist is just going to be the puppy that rolls over and, wants their belly pet, then again, the alpha, and I'm oversimplifying, right? But the alpha person is not going to respect and not going to engage with that, right? And so that, especially in expressions of anger and rage, sometimes that's a test, even if it's unconscious, right? Is that if the client starts to get activated, starts to get angry, leans forward, starts to yell a little bit, or however it is, grab a pillow or whatever, it is their experience in the moment, but it's also a test. Because then if the therapist cowers and shrinks and is immediately pacifying to that behavior and emotion, then it's just said, oh, okay, I don't respect you now, right? You're down here, right? And I'm up here, and anytime that I show my teeth, you're just gonna roll over and show me your belly. And so I'm not gonna listen to you when you tell me this is what I need to do in my life, right? Does that make sense?
Yeah, very much. And one thing that our community does is look at video segments of psychotherapy. And there are some therapists out there like Joseph Tanhab Libby and Kees Cornelison, where you get to see them with very provocative clients, and they just sit there.
Yeah.
And it's almost like, okay, are you done?
Yeah, exactly. Yeah. 100%.
Yeah. So, I feel grateful to my clinical community because it's really taught me how to just sit with someone, no matter what they're sharing, and to not personalize it, but to just be open to exploring and understanding.
Right.
And I know what's helped me the most, and it's really kicked in this past 2 years, is us as therapists doing our own work. Therapy,
yeah,
working out, meditation,
yeah.
and anything we expect of a patient to be doing at home for ourselves. And it's a game changer. Yeah.
Right. Yeah. And it couldn't hurt that even, if this is a population that somebody wants to work with in any type of consistent way, that personal work should probably involve a little bit of being physical and a little bit of violence and aggression too, right? So you don't have to go and join the military by any means, right? But you could go and take some boxing classes, right? Or some jiu-jitsu classes, or some type of martial art or something like that, and really engage in that level of self-discovery of like, okay, well, what is it like to be violent and aggressive in a non-pathological way, right? In a safer, healthier way. And then dealing with that, because then you're not going to have that kind of demon of countertransference that's going to live in the shadows and wait to come out.
Absolutely. And this is where Jungian theory is so essential to the work that we do. We really have to understand our shadows.
Yes. Yeah.
And the more we understand our shadow as a human being, right, the more
Yeah.
we're able to help understand our patients and help them be able to see themselves, the lightness and the darkness. And so I thank you for, reminding us of that. So I'm just wondering, does anyone have a question for Chad? Go ahead.
Yeah, I wrote it in the chat. I was just wondering, do you have like a specific example of a veteran that you worked with, that had rage or violence problems, domestic violence or something, and then how you kind of took him, to like major points or some breakthrough or whatever that, and where he's at right now, how long that process took, and just kind of take us through a little story if you can.
Sure. There's certainly a triage type of situation that's gonna come up, and so with the person that I'm thinking of, they were veterans and they had combat experience, but then also they had a personal life that was just packed full of abuse, and they had lived in gangs on the street, and so really an entire life of kind of violence and aggression. And the military was just kind of the last icing on the cake experience for them. But for them, they were so dysregulated because of the PTSD and because of the trauma that really it kind of started with psychoeducationally trying to like, okay, this is what trauma is, this is how it's affecting you, and here's some steps we need to kind of get that under control so you can cope day to day. And then we can start to add in a little bit more insight, a little bit more change. And then kind of their big breakthrough came when they started to identify something that they felt they wanted to do with their life that was outside of that model, right? So not just the shame and guilt of I've done bad things, or I've been a bad or out of control person. They identified for themselves, ironically, they wanted to go and become a therapist themselves, right? They wanted to go to school and they wanted to pursue psychology and to try and help. And so starting to really identify that as an additional identity to start to work towards gave them a positive to work towards. And so the work wasn't just, let's get rid of a negative. It was, okay, let's transition to a positive that's self-identified, and they develop and they identify for themselves. And so that person probably, it took about a year before they kind of got to that first point, and that first year was really about just, again, developing the relationship and then also just trying to teach them to cope better. But then once they really started to identify for themselves, this is who I want to become, then we had a place to unpack and kind of transfer identity and value and those types of things and make it take steps in a concrete way to become this additional identity in person. Does that make sense?
Yeah, and I just want to share, Chad, in our community, there's Jeffrey Magnavita, who's a trauma expert, and he owns this company called Strategic Therapeutics, where he's offering like free education in terms of like helping therapists learn how to do better therapy. And he's very good at doing what you just described because he comes from a family systems perspective. And, other people who are also helpful with this is, Michael Alpert, Diana Fosha, they really teach how to work with clients in a very slow kind of step-by-step way to just really see like what needs to be unpackaged and how to move forward. So that's super helpful.
Great.
Yeah. Go ahead, Melissa.
Oh, hi there. Thank you so much. This is really informative. I signed up to work with this organization called Give an Hour a couple of years ago, where therapists offer, free therapy to a veteran. And I would say of like the 3 or 4 people that contacted me and came, they did not stay. I mean, I worked with them like 1 or 2 times, and that was it. They never came back after they kind of even told me their story. That was the end. So I know, I just wanted to say that, but also the couple of women that I saw in the military were so psychologically traumatized, even before they went into the military. Then they got into the military and they were both sexually assaulted by fellow, soldiers. So it was like just trauma on top of trauma on top of trauma. And I mean, the other component of this you haven't really talked about, and it's probably a whole other, hour, would be this kind of moral trauma where, these people are suffering with so much shame and guilt and trauma for what they've done, and I have to believe that's tied in with so much of the anger.
And Melissa, I'm reminding myself it's what they've done, what they've witnessed too. It's no different than with traumatized children. It's like when they've, whether they've been hurt or they've watched their siblings being hurt, the like guilt involved with not being able to protect another is just through the roof. Yeah.
Another thing, and it's more of a, in some ways it's rhetorical, but we all live in a society and a culture that, speaking largely with kind of current Western society, where understandably so much of the extremes of violence and aggression are criminal, pathologized, and everyone just kind of thinks of the perpetrators of that as monsters, understandably so. But we can also think about, if you look at people when they're placed in extreme situations, they don't behave like normal civilized people. So what is normal behavior in those situations is monstrous behavior to the society in general. And so that disconnection is something that therapeutically is trying to bridge that and say, okay, in some ways you're almost normalizing what they did within the context of when they did it. And so you're not a monster because you did that, or you saw these things, or you even just watched as someone else did something that's terrible. Because psychologically, and I asked this in the academic setting, and this is part of my class towards the end, is to say, how do you think that you would act if you were in that type of a situation, right? And of course, the natural reaction is to be like, oh, well, I would force someone to stop, or I would be a protester, or I would abstain, or I would something like that, because our self-concept is one that's very civilized and doesn't deal with that. But there's absolutely no evidence that that's actually how it would happen. The vast majority of people would join in willingly if they were put in that situation. So it really speaks to a side of the human experience that is, in those circumstances, normal, but in normal civilized world is pathological and monstrous. Does that make sense?
I suppose I was sort of thinking about the issue of them not staying in the treatment and wondering if there's very common, I know every case is different, but if you could maybe comment on that at all, if you've seen any like general reasons for that?
In my experience, at least from what I've heard, and I can kind of get this from both with people I've talked to, but then also, looking just kind of as a voyeur at chat boards and places where veterans talk, I think it again goes to this cultural incompatibility that they don't see the therapist as someone that they relate to, that they respect, and that really understands them, right? So it's kind of like, you know, the stereotype that a lot of them are operating under is, oh, here I come and you're going to tell me to talk about my feelings. I'm supposed to cry and going to endlessly validate anything that I say and ask me how that feels and blah, 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 blah. And that has no interest to them. And that's not in any way valuable or appealing to them. And then there is again kind of that dynamic that I spoke of the dominance hierarchy thing of respect as a person. So if this is, you know, if this is this kind of compassionate, mild in some way, temperamental person, how in the world are they going to understand and value the world that I'm coming from and this identity that I have? It's right. It's just kind of an apples, you know, it's kind of an oil and water incompatibility. And so if they sit down and it starts, you know, we kind of go through the general get to know you and start to build the therapeutic alliance in kind of the standard ways, they quickly check out because that's not a process that they're invested in, and it's not a process they value.
Well, and I'll say one more comment and then we need to wrap up for today. The first thing that I do is I just expect to be fired in the first session. That's I go in and I'm like, this could be our last moment together. And then I lean into my intuition at the highest level. I'll hear my voice say this. And I'm like, I'm not going to say that, say this. No, yes. And then I say it and it's the exact right thing to say, you know, so listening to your intuition, sometimes your unconscious finds that moment of connection, much more so than your clinical, you know, perspective does. That's been very helpful to me. And more than anything, I've learned that they need what we got. So, we have self-compassion, self-love, self-protection, you know, connection with others. And, you know, deep down inside, they want to feel connected with others in a very real way. And the transition from military life to civilian life is so hard and so difficult. And we can help them in that transition, and we can help them heal from, you know, what they've experienced and help them understand how it's affecting their families and their colleagues. So I just always keep that in mind. I got the goods here.
But Kristin, do you think maybe our approach needs to be modified? I mean, an emotion-focused therapy approach, in terms of what I'm hearing from Chad, isn't necessarily the best way to go at it with.
Yeah, I mean, I found with Chad, what Chad said is that the feelings arrive when it's the time to arrive.
Right.
You know, and so I really, when I'm working, I'm paying close attention to the triangles. I'm doing a lot of regulating anxiety. There's a lot of anxiety around acceptance, you know, judgment. Am I being judged? Will I be rejected? And so we do a lot of work about, you know, what's the worst thing that can happen here if you open up with me? You know, will I judge you? You know, if I do, I'll tell you, right? Will I reject you? If I'm feeling that way, we'll talk about it. Because, you know, sometimes they do have things to say that can be alarming or uncomfortable. And you just have to have a commitment that you'll put it on the table. You know, that whatever happens here is on the table, and let's talk about it. And one of the best terms that I learned from Sean Hansen, who's a prior guest, Sean has taught me many times about what I should be considering. You know, he said that, you know, when you're working with veterans, you can always say, like, how can we change this up? Like, how can we change what we're doing here to have it work better for you? And that's been a game changer for me, to just say, like, what's working and what isn't. And so that helps out a lot.
Mhm.
I'd
But
just like to throw in, I think, in a concrete way, especially at the beginning, portraying some, and of course it has to be authentic, but to think about if I'm portraying some type of strength and confidence, not necessarily physical, but just in my character and who I am, that makes me a much more respectable person in this kind of establishing the hierarchy type of way, right? And so I'm someone to be reckoned with as an equal, rather than someone who's passively showing up to be the helper. I would also say that, you know, I almost always try to, with beginning sessions, leave with some type of really concrete steps and homework, right? Because that again goes back to that seeing therapy as training, right? When you go train, not only are you doing the workout, but then the coach is going to tell you, okay, on Tuesday you have to go do sprints, on Wednesday you have to go and do push-ups, or et cetera, right? You're going to have a very concrete training plan that moves you towards your goal. And so if you can, I've found it very helpful and very receptive on the other end of when I'm saying, okay, specifically, we talked about X today. Here are specific exercises that you can do this week, right? So not only that helps them, again, through that rational lens, understand and buy into what's going on, but then they can see progress in a concrete way from the get-go. I'm not just wasting my time talking about feelings here. You're actually, we're actually learning skills, and that's showing up in my life in very measurable, concrete ways. And then if they have a hard day or they have a hard week, whatever, and they come back, almost again, talking about it in that training type of model, that training type of dynamic, it's like, yeah, that was a rough week of training, right? And it kind of kicked your butt. So, but that's good, right? That's how we make progress. And they really buy into that, right? Because for them, overcoming the odds, fighting against the difficult thing, that's where their identity and value is placed. And so when I'm kind of translating the therapeutic process into that language, they eat that up.
yeah, really wise words, Chad. I mean, it's everything that you've said. And I think being your authentic self makes all the difference in the world. And I learned that from working with traumatized children, is that I had to really be true, or they would pick up on it and distance themselves from me. So Chad, thank you very, very much. I'm excited to get this video recording. I think it's going to be extremely helpful to therapists, but also to patients too. And I'm just so grateful that you were willing to come and join us today. And
my pleasure. I'm grateful that I got the chance to talk to you.
yeah, so I would like to find other ways to talk more,
Sure.
just like Sharon said. So maybe we need to move on that podcast idea.
All right, I'm down.
All right. Well, thanks to everyone. It's so good to see you. I miss you so much. I feel so happy that you've been able to join us. And have a wonderful week, and stay in touch, and we'll let you know when our next therapist hour is. But for right now, we have our anchor. Take care.
Thank you.